Hey, what are you doing drinking that? Come on upstairs. I got something better for you. Been in this industry for it's about 20 years, actually. 15 years in practice. Been in this space for over a year now. But my vision is to create the environment for people to get well. What inspired Elemental, the name Elemental, for us meant the elements. So when we talk about in Chinese medicine, the 5 elements. But the other part of it was also elemental natural medicine, meaning fundamental, back to basics medicine. What we notice in primary care medicine is the basics are missed all the time, and we're treating symptoms all the time, but we're not getting it to the basic things. We offer, Qigong classes, which is like Chinese yoga without the stretching. It's a lot of breathing and relaxation and joint mobility, and we offer yoga once a week for our clients. So we're trying to build a space that supports people's health and relaxation. So let's go check the yoga room out. So these are small classes. They're 5 people or less typically. So we use this space. Now we take this stuff out. We do offer also private health coaching and neuro coaching. So we really try to address mind, body. So it's really personalized attention, and it's included for clients.
So someone that isn't a client, could they book with you for yoga, or is it just for clients?
They could do drop-in. Yeah, we do have a drop-in fee, like $12 or something like that.
Not bad at all.
Our classes are normally Monday from 4 to 5 for Qigong. And then yoga's from 12 to 1 on Tuesdays. So
nice midday relaxation.
Exactly, yeah.
I'm a big yogi, so
Get out of the office, come on over.
I will. You're very close to where I'm located. Do you ever have someone that's healthy that walks in here just looking for, I guess, better for themselves?
Yeah, so that's a great point. So there's 2 types of people I normally see. One is frustrated with primary care, being told, gaslit often, they're being told they're fine or it's in their head, and they know that's not true. And then the other group of people are people who are already naturally oriented. They want to go to a natural doctor as primary care. They're already, used to eating healthy or trying to live a healthy lifestyle. So we're just supporting them in that, and we'll often work with clients in maintenance, so which means they'll come in once a year. If they're doing really well, we'll just do a really good blood test and have a 90-minute visit, and we'll go over it in detail, and they'll know, hey, this is going really well, keep going, and this we need to work on. So for the next 6 months a year, this is what you want to focus on. We don't turn anyone away.
Kind of looking at your office space in here, as a girl, when I see this table, I think I'm about to get a massage. So what do we do in here exactly?
Yeah, so actually there's a lot of overlap with massage and acupuncture tables. They're actually not that different. We do acupuncture often from the elbows down and the knees down. Our clients just walk in with loose-fitting clothes, kind of like what you're wearing would be perfect. We have heated tables here. They're heating pads underneath, and these can be adjusted, and we also use an infrared lamp as well for heat. So we try to encourage blood flow and circulation, and healing usually comes with that.
I will try anything once. I'm open to everything. But I am scared of needles, slightly.
Well, acupuncture are very thin needles. They're hair thin, really. So, you can fit 10 of these into the head of a hypodermic needle, which is what most people are used to for blood work. So these are more like the thickness of your hair. These are what I call my baby needles. So these are probably what I would, and I don't mean to call you a baby, obviously, but these are for needle-sensitive folk. I don't tell people they're not going to feel anything. You're going to feel something. We're tuning up your nervous system and your circulatory system. Generally, though, the outcome is what you're focused on, meaning how are you going to feel after the treatment. I work with a lot of folks who said this exact same thing, and they were courageous and they overcame it, and they tried a treatment, and they're like, oh wow, I'm glad I did, because I feel so much better and I'm on the path.
Going on that note, what is a common health misconception that you could debunk right now?
I think just a common one is knowing what's out there. There's more than just conventional medicine. I think sometimes that's a stretch for people. We're conditioned in our society to go to the doctor and get the pill, get the antibiotic, get whatever. So it's a different approach to health. We're not treating reactively, we're treating proactively. Kind of the mark of a great doctor is someone that whose clients don't get sick. And the clients we work with are usually dealing with autoimmune conditions. So those are chronic, and they're being told in the primary care, just take your medication. And it's like, no, there has to be something else I can do besides taking one pill for this and another for that. So with every client we work with, we want to know what your goals are, and we want to know why you want to reach your goals. What's your commitment? Because healing is very rarely this. It's often peaks and valleys. And so on those tough days, you got to come back to your why. Why am I doing this? Why do I want to get healthier? What's my commitment? What's my bigger purpose in life? But we want to know what your goals are and what you're aspiring, because we're just connecting you. We want to get you where you want to go.
How can the whole community support you?
First is just being aware and getting the word out about natural medicine, functional medicine, understanding there's a lifestyle approach to chronic health challenges that isn't just about taking pills and getting more pills and more pills.
It was a couple of years ago that I read that Utah is like the #1 state for abusing opioids. Being not from Utah, what brought you to St. George?
So I actually, we moved our family here. I was offered a job opportunity here with a clinic that was doing similar work at the time, and I was really interested in crossing over from strictly a Chinese medicine background to more of a what we call functional medicine. This has been, quality of life here has been fantastic. The community has been very welcoming.
What do you love the most about the local business scene in St. George?
Just how supportive we are of each other, in my experience anyways. You know, we have in St. George alone, I think 7 or 8 BNI chapters, which is incredible for the size of the town we are. It's been really a supportive community. It's nice. It's really nice, because in a world where the big box corporate is kind of taking over a lot, in this community, it's the opposite. I feel like we have so many thriving small businesses, and we're really symbiotic. We need each other. So long story short, you got to drop the soda and try one of these. This will support your mood. It'll support your relaxation. These are what we say healthier for you. So I think you'll get more out of this. I think it'll be better for you.
Well, thank you so much.
You're welcome.